As like a millennial 32, it's not really something that my friends and I discuss. We don't get together on Saturday and say, do you have your measles vaccine done?
Jake Elise assumed he'd gotten his MMR vaccine for measles, along with all the other childhood shots. A blood panel showed he didn't have immunity. So with measles spreading through the state, Jake made the trip to Denver Health.
Just getting my MMR vaccine today.
It's not just Jake. Bob Belknap says Denver Health is seeing an increase in the number of people getting MMR shots.
Yes, the biggest increase we saw in younger kids, and primarily in that age group, that 0 to 4 age group.
Belknap chairs Denver Health's Public Health Institute. He says their ambulatory care service clinics began contacting families with kids who hadn't been vaccinated after the first measles case in Colorado back in March. They vaccinated more than 3,200 people this year, up 13% over last year. And measles vaccinations at public health immunization clinics, like where Jake got his shot, are up too.
We've also seen an increase in vaccinations, interestingly, among older adults, so 50 and older. And I think most of that is probably people who were uncertain and didn't have documentation of their immunity.
Colorado's MMR vaccination rates sit in the high 80s. Belknap says that's below the 95% needed for herd immunity. With 14 measles cases so far in the state, 8 of those in unvaccinated people, Belknap says they're hoping to bring immunization numbers back up to stop people from getting sick.
It really is the most contagious virus we know of. It's 9 out of 10 people who are not immune and get exposed will end up getting sick from measles.
Jake says this shot in the arm is something that helps him feel more comfortable.
There's absolutely no reason to not do that.
As Rachel Krause reporting, Denver Health says if you think you've been exposed to measles, give your health provider, their location, a call before you show up so they can take steps to protect others just in case you do have measles.